Later this morning, the largest panel of pharmaceutical CEOs in decades will be testifying before the Senate Finance Committee on this issue. Joining us right now is the man who's leading that commission. Senator Chuck Grassley is the chairman of the Senate Finance Committee. And Senator, thank you for being with us today.
Always glad to be with you. Ask me anytime.
What do you think? Is this the one area in Washington where you actually will see some bipartisan support?
Well, so far, everything I've read that the new majority in the House of Representatives wants to do and what my colleagues on the Senate Finance Committee want to do from both Republicans and Democrats, it looks like we put together, well, first of all, we have a very good opportunity of having bipartisan results and bipartisan legislation come out of this. And this hearing was put together in a very bipartisan way. The companies that we're having on the panel today were agreed to by both the Republican and Democrat members of the committee, and they generally include companies that have had drug pricing issues from our respective constituents.
We can look through the drug price individual situations where drug prices have risen 200, 300, 400, 500%, sometimes even higher than that. But what do you think the problem is before you get these CEOs in front of you today? Where would you point the finger of blame?
Well, I'll answer your question this way if it does answer your question. If it doesn't, tell me. But I think that there's not enough information available about how prices are arrived at. There seems to be a great deal of secrecy. And for me, on a lot of legislative issues, particularly my oversight work, transparency brings accountability. So we need to get some transparency into it. When there's more transparency, the marketplace ought to work better. And then in the end, we have to have some explanations of why, for instance, prices are set way up here, but then there's rebates that bring the prices down here. What happens in between, and how come consumers shouldn't be paying the same price and the lower price instead of what's going on in between?
So I'd say it's fair to assume that you think the situation of rebating either to the health insurance company or to the pharmacy benefits manager, the middleman in between, is a bad idea. Would you be in favor of banning that practice and say the list price is the list price?
I'm not sure I can answer your question now, but we've got to have some explanations of why. And it doesn't seem reasonable to me that we have this differential. And by the way, we're not going to stop this investigation just with pharmaceutical companies. We're going to have PBMs and other
players in the industry.
Companies, people that are making these deals and bringing about the rebates, and what's their role? Don't seem to know as much about that as we ought to. And then what extent is the free market not working? What extent is there collusion, as an example?
The administration has put forth a plan that would tie Medicare drug pricing to drug prices in foreign countries where those prices tend to be cheaper. The industry has come out against that for the most part. Where do you come down on that?
Well, I think that I don't want governments overseas setting our prices here in the United States. I want them to be negotiated in the free market. I want a willing buyer, willing seller to make that decisions. But
meaning you'd like more competition? You'd like more Medicare's ability to go ahead and negotiate that?
I don't want the government negotiating, if that's what your question is.
Well, the government basically is the biggest payer for these things. They tend to set the rate. If they're not negotiating, there's other people who have said that you'll never actually get to lower prices.
Well, when you brought up government negotiation, I thought you were bringing up to have Part D of Medicare be handled just exactly like VA. I'm not in favor of that.
Right.
But I am in favor of more competition and the extent to which we can have importation of drugs. I've supported that for a long period of time and will continue to vote for it. But also understand we have pay-for-delay schemes that Senator Klobuchar and I are introducing legislation to do away with those.
Which is what?
Pay for delay is when a patent runs out, the brand company goes to a generic and pays them to keep the generic off the market. So obviously you don't get the cheaper drug on the market as fast. And then another one would be when they don't cooperate with with a generic company to get the information that the brand company has, so they can get something approved by the FDA a lot faster. Then the idea is to get generics on the market faster, so you have more competition because generics are cheaper.
All sound like very interesting ideas. Senator, we hope you get a lot of answers today, and we hope you will come back and give us an update on what you learned from it.
You ask me and I'll be here.
Thank you very much. Senator Chuck Grassley.
I'm out next week. You think Senator wants to come in here? And I mean, he'll come anytime.
Come in and be for you.
Sit here.